Welcome to Orange Enterprises, where your health is our priority. Welcome to Orange Enterprises, where your health is our priority. Welcome to Orange Enterprises, where your health is our priority. Welcome to Orange Enterprises, where your health is our priority.
And his colleagues. Psychoeducation is also used to describe a behavioral therapeutic concept. It intends to promote a client's insight and understanding following a mental health diagnosis. It is also an important component of psychotherapy and counseling. Psychoeducation is, moreover, a therapeutic method or medium.
Psychoeducation is also used to describe a behavioral therapeutic
into a
concept.
simple way.
It
The
intends
client's
approaching to the
promote a
therapist.
client's insight and understanding.
Next, we
following
are moving on to the
a
goal
mental
of
health
psychoeducation.
diagnosis. Now,
It
goals
is
of
also an
psychoeducation
important
are
component
highlighted here
of psychotherapy,
helping
people
and
be
counseling
aware of the psychological
Psychoeducation
disorders
is
moreover
or mental health
therapeutic
challenges, methods, or
experience.
medium
Psychoeducation is also used to
building
describe
sense of
a behavioral
complicated
therapeutic
things in
concept,
developing
support
it
to the client's
intends
informed
approaching
about
to
the
promote a
legislation
client's insight
and government
and
health.
understanding
Next,
following
proper handouts
and
and
mental
tools
health
of
are
psychoeducation.
necessary for highlighting
Now,
the
goals of
disorders
psychoeducation
or
are
highlighted
challenge of
here,
psychotherapy.
helping
Now, what
and
is the
be
importance
aware
of psychoeducation?
psychological
Psychoeducation
disorders,
is
counseling,
moreover
or mental health
therapeutic.
challenges,
We can
methods,
say
or
that
medium
psychoeducation is
manner
also used to
building a
describe
sense of
a behavioral
mental
therapeutic
health in
concept
developing
and support
in
to
the
the
client's
client's
informed
about the
about a
legislation
client's
skills
insight
and government health.
and understanding
Next,
following
proper handouts
to
and
mental
tools
health
of
are
psychoeducation.
necessary for highlighting
More
the
people
disorders
of psychoeducation
or
being
highlighting
challenge of
here,
psychotherapy.
helping
Now, what
people
is the
become
importance
aware
of psychoeducation
disorders
is
counseling
moreover
or mental health
therapeutic
challenges.
towards the client.
Methods
Say
or their
psychoeducation
is
and
also used to
building a
describe
sense of
a behavioral
behavioral
very
therapy
clear
concept
about
and
the
support
in
in
the
client's
client's
informed
informed
about
about
the
the
client's
client's
skills
insight
and government
and
health.
understanding
Next,
following
proper handouts
to
and
mental
tools
health
of
are
psychoeducation.
necessary for highlighting
More
the
people
disorders
of psychoeducation
or
highlight the
highlighting
challenge of
here,
psychotherapy.
like
Now,
helping
what
and
is the
become
importance
aware
of psychoeducation
disorders
is
counseling
moreover
or mental health
therapeutic towards
challenges.
the client.
Methods
Say
or their
psychoeducation
is
and
also used to
support
in
in
the
client's
client's
informed
about
about
the
the
client's
client's
insight
skills
outside
and
understanding
proper
following
handouts
to
and
mental
tools.
health.
It has
Are
been
necessary
necessary
for
of
highlighting
more
the
people of
disorders
psychoeducation
or
highlight the
highlighting
challenge of psychotherapy.
like helping
Now, what is the importance of psychoeducation
is
moreover therapeutic towards the client. Say
or their
psychoeducation
is
and
also
building
used information from non-repeatable sources.
support
in
in
the
client's
client's
informed about
the
the
client's
client's
insight
outside
and
understanding
proper
proper
handouts
handouts
and
and
tools.
tools. It has
Are
been
necessary
necessary
for
of
highlighting
more
the
people of
disorders
psychoeducation
or
highlight the
highlighting
challenge
here,
of psychotherapy.
like
Now,
helping
what
and
is the
become
importance
aware
of psychoeducation
is
moreover
mental
therapeutic
health
towards the
challenges.
client. Say
Or their
psychoeducation and
used
building
information from
in this
non-repeatable
in a
sources.
very
In
in
the
client's
client's
about
the
the client's
insight
outside
understanding
proper handouts
to
and
mental
tools.
health.
It has
Are
been
necessary
necessary
for
to
highlighting
more
the
people of
disorders
psychoeducation
or
highlight the
highlighting
challenge of
here,
psychotherapy.
like
Now,
helping
what is
and
the
become aware
importance of psychoeducation
is
moreover
or
therapeutic towards the client.
say
Say
or their
psychoeducation and building
information from
in a very
non-repeatable sources.
support
In the client's
about
the
the client's
insight
outside
understanding
proper handouts
to
and
mental
tools.
health.
It has
Are
been
necessary
necessary
for
to
highlighting
more
the
people of
disorders
psychoeducation
or
highlight the
highlighting
challenge of
here,
psychotherapy.
like helping
Now, what
and
is the
become
importance
aware
of psychoeducation
is
moreover
or
therapeutic challenges
say
or
their
psychoeducation and
building
building
information from
in a very
non-repeatable sources.
support
In the client's
about the
the
client's
insight psychological interventions in a very Number two is it can be a major challenge in telemental health or counseling through over the phone or through the telemental health medium because the client might lack of reliable psychological interventions. They might not rely it can lead to it can be a major information challenge in telemental health if we are giving to the client it counseling through over the phone or through the telemental health of the information or the client might not be able to the client might absorb the information that is family therapy it can be a major information challenge in telemental health we are giving to the client so it can be also over the challenge it can through the telemental health of the information or the client might faces with psychotic disorders the client might absorb the information that relies on family might not rely it can be a major cultural challenge in young mental health or in the family. So it can be over the person or to the psychotic challenge may not absorb clients with psychotic disorder or said by the might absorb the information that relies on it can be a major cultural challenge in young mental health or in the family. So it can be over the challenge why the psychotic challenge may not absorb clients with psychotic disorder or said by the might absorb the information that relies caring for their loved ones. Last, which we will focus, is the comprehensive model. Comprehensive model is also known as a combination method. Now, why is it known as a combination method? Because it combines knowledge with skill development and supportive models. Members of this approach initially get lectures regarding the ailments. They must participate in a support group for multiple families. They must actively participate in the final phase, especially in individual sessions with a mental health specialist. Now, psychoeducation may be individual, family group, in a family, or we can convey it to a group or community based depending on the target population that we want to focus on. It may also be compliance or adherence focused, disease focused, therapy focused, or it can be also rehabilitation oriented. And depending on the prevailing focus. Passive psychoeducation entails the therapist. Also, a therapist may use passive psychoeducation in a busy clinic with time constraint by giving out brochures or educational materials on the illness that are written in plain language that the patient and their guardian can readily grasp and absorb. Single family homes or group of families with patients who have similar illness can both benefit from family psychoeducation. Now, since most Indian patients, unlike their Western counterparts, remain with their families, so family based psychoeducation programs might be highly helpful in the Indian context. Studies on schizophrenia and bipolar disorders have shown that family based psychoeducational approach are successful. When dealing with severe mental diseases, family education is particularly crucial since during the symptomatic phase, individuals lack insight and may be unwilling to take medications. In order for them to recognize and receive the appropriate support, it is also beneficial to make them aware of the early indications of recurrence. Patients with similar illnesses typically participate in group psychoeducation. Patients with schizophrenia, substance abuse, etc., may be included in groups. The formation of a group with individuals suffering from various illnesses is not preferred. It should be an ideal group size of 8 with members often ranging from 4 to 12. The typical range of the session must be 5 to 24, with covered for each condition remain the same. However, the number of sessions may change, often depending on the sources or the resources, that is, resources in the form of time and manpower available. The lessons typically are run 40 to 60 minutes and are scheduled primarily every week. Now, let us move on to the next section, which is often confusing. That is mental health literacy. Often people come up with the doubt that whether this mental health literacy or psychoeducation is the same thing. And they have a doubt with psychoeducation and mental health literacy are both have the same meaning. But uh, to explain it in a broader perspective, psychoeducation and mental health literacy goes together. As we are discussing psychoeducation, that we cannot ignore mental health literacy. So it is just like an orange and lime. Both are tangy, but taste and essence are very different. The utmost aim of psychoeducation is transparency towards the client or their caregivers and family members, being very clear about the therapies and the necessary protocols that needs to be followed. Now let us check out what actually is mental health literacy. It is a knowledge and beliefs people have about mental disorders that can help them recognize, manage, or prevent them. Being aware of symptoms of mental health disorders such as anxiety and depression, understanding risk factors and causes of mental health disorders, knowing about available self help and clinical resources, learning how to seek mental health information, and having attitudes that encourage recognition and appropriate help seeking. The mental health literacy is defined as anxiety and depression, understanding risk factors or different types of psychological distress. But it is equally relevant to all community. Now let us see components of mental health literacy. Understanding how to achieve and maintain a very good mental health. Understanding mental disorders and their treatments, decreasing the stigma related to mental disorders, and increasing the effectiveness of help seeking. Now, moving on to the next part, that is the case discussion. Often there are problems which the clients themselves also come up with. Now, I have highlighted two of such cases, which we will see and will give a clear picture why mental health literacy as well as psychoeducation, which both goes together, both are going together, is very important. So case number 1 goes about like this. Client D shared since last week, 2 weeks, she was experiencing sudden palpitation, breathlessness, and it usually happens at a particular point of time of the day, which is faced usually by her. Gone through consulting with several cardiac specialists, even pulmonologists, and each time ended up with several tests as well as ECGs and various such tests. But results showed that everything seems to be perfect in the test that was done. But when she discussed her problem with one of his friends who knows about her problem, and the instances of her recommended her to take help of a mental health professional, and ultimately after few sessions she realized that what are the things that is going on with her and how to cope up with full assistance of mental health professional. Now this is a case which I came up like before 2 weeks ago, where this patient, the client came, as I have not revealed the name of the client because it is against the counseling protocol, we cannot name. So I have just highlighted as the client name as D. So when she came up with the problem, earlier she thought that she's having a cardiac issues or lungs issues or whatever is going on, something is going wrong with her. But when she one of her friend, she came to know that maybe there is a much more than that which is happening with her. Maybe it is not the physiological problem that she's experiencing, might be something psychological, because we get a clear picture because the friend knew about certain mental health topics, or he went through certain articles or something like that, which educated him or gained some knowledge about mental health. So when we look into this case, it gives a very clear picture how the psychopathology associated with the panic episodes, with the severity could be detected on time and necessary steps was taken. How the mental health literacy of the client's friend could save the much adversities of the problem at the right kind of or right at the right point of time. Process of psychoeducation in this case was very smooth, which we went through during the counseling session process. But let us now look into the case number 2. It might happen in the counseling process or in the session that the psychoeducation process might not be as easy as we are thinking to be. Even the person who are coming to us may not have the mental health literacy. Okay, so this is such a case which came up. Now, client B is 13 years old. The behavior of the client is that she's becoming isolated from her friends and getting irritated in small things, becoming socially distant with everyone. As reported, the client has lessened communication with friends, even with her relatives, compared to earlier, and reluctant to go to school. No abnormality was noticed during prenatal and postnatal period as asked. Along with birth cry was also present. Everything was normal when she was born. While we were taking the case report, client had eye contact during the session. Client seemed to be gloomy. Rapport establishment was good, but took a little time. There was a reluctance for few seconds starting of the session from her side. No family history of medical or psychiatric illness in the family. Both of the parents of the client is working. Time spending with the child is very limited, and it's very average. When asked to parent who have recommended, they said that their teacher did. The girls or the client's teacher recommended their parents, the client's parents, to take help of the mental health professional. They did not thought of visiting and taking mental health help, as no one from their family ever had to face with such problems before, and ultimately needed to rush to mental health consultation for their daughter. But what is seen in this case is mental health literacy was present in the school teacher, so she could recommend her to the counseling session for seeking help from the mental health professional. But the mental health literacy was a little bit vague in case of their parents, and also psychoeducation was really rigid in this case, as acceptance of the problem faced by the child by their parent was very tough. And usually when the acceptance is taking time, the counseling session timing is also very time consuming. So psychoeducation is moreover a therapeutic medium to convey complicated things into a simple way to the clients approaching to the therapist. The utmost aim of psychoeducation is transparency towards the client or their caregivers and family members, being very clear protocols that needs to be followed after the diagnosis. Now, how can psychoeducation be done, or what is the medium of psychoeducation? Now, few medium of psychoeducation which can be imparted to the client or to the general people are these: handouts of mental disorders, and the specific treatments must be highlighted. Okay, so such as the brochures or recovery stories in the form of pamphlets or brochures can be given to them. Audio and video content can be posted or can be shared to them, so that they get aware of the mental disorders or the problems that the client is facing, and get more in-depth knowledge about the mental disorder or mental health issues that they are suffering from. And the specific which I want to highlight here, not only knowing about the mental disorder or mental health issues, but the specific treatment or therapy that is needed for the particular mental health issues that they are suffering from is very important. If somebody is suffering from, say, anxiety or depression, what kind of treatments or what kind of therapeutic procedure that they need to take should be made aware to the clients, as well as to the caregivers or the family members. We can give the information, the psychoeducation to the caregivers or the family members, even when they are suffering from mental health or psychotic disorders such as schizophrenia, where the insight is not there at times. So it is very important. And this psychoeducation is a very good medium to be very clear in whatever conveying to the, and it is a kind of maintaining transparency between the therapist and the client. We don't have to hide anything. We can say or we can convey the information in a very good manner or in a proper manner. And people who are giving psychoeducation must be at least trained or have some knowledge about it. So at last, I would like to convey that let us be aware of what we and our people around us going through it will help each other, helping each other and everyone in this journey of life to make it better and be healthy, both mentally and physically as well. So I hope this session was helpful and it was insightful, and hope I could convey information to everyone through this medium. And thank you for joining us live. And once again, thank you everyone for giving your valuable time and joining us for the session. Hope I could convey some information to each one of you joining us here in this portal. So thank you everyone.
Welcome to Orange Enterprises, where your health is our priority. On our online platform, www.orangeshopee.com, we bring healthcare right to your fingertips. Whether you need a consultation with expert doctors, psychologists, or pharmacists, our team is here to provide personalized care whenever you need it. But that's not all. We also offer comprehensive medical services, accurate services to essential medical and delivered directly to you. www.orangeshopee.com today and experience the future of healthcare services. Orange Enterprises, where care meets convenience. Welcome to Orange Enterprises, where your health is our priority. On our online platform, www.orangeshopee.com, we bring healthcare right to your fingertips. Whether you need a consultation with expert doctors, psychologists, or pharmacists, our team is here to provide personalized care whenever you need it. But that's not all. We also offer comprehensive medical services, from accurate diagnostics and reliable pharmacy services to essential medical and surgical supplies, delivered directly to your door. Visit www.orangeshopee.com today and experience the future of healthcare with our innovative services. Orange Enterprises, where care meets convenience.